Welcome to my micro series where we discuss strategies on how to survive nursing school. Hi, my name is Larissa. I help people that are interested in nursing get started, and I help nurses make more money. Let's talk about assessment. Now, like fundamentals, a lot of nursing students find assessment to be very boring, but I'm going to tell you this. Nursing assessment is one of the most important courses you will take in the entirety of your nursing career. I have taken nursing assessment 3 times. I did it in my accelerated associate's degree program, I did it in my BSN program, and I did an advanced in my MSN program. All right. These skills and things that you learn, you will use it throughout your nursing career. And very likely, these things that you learn when it comes to assessment will likely save your patient's life at some point in time. Now, most programs I have seen use a assessment book by Jarvis or Bates. Okay, I've used both, Jarvis twice and Bates once. Now, this is an old Jarvis book that I have. Is this Jarvis? Yeah, old Jarvis book that I have. And let me just go to one of the systems. Okay, this one talks about eyes. So the books are kind of very similar, right? Where you have all of the abnormalities over in this column and then the expected findings and assessment that you would do in the wider column. A little cheat code is when you're studying, make sure you review those abnormal findings. Oftentimes, those sort of things will pop up on the test. Other thing is, at the end of the chapters, they usually do a summary of all of the abnormal findings and how to do the assessment for that specific system as well. Now, hopefully, you have a professor that will help narrow down the things that they're going to review or go over or test you on, hopefully. Now, another portion of the assessment class is the checkoff, making sure that you know how to do a head-to-toe assessment. You will do practice on this in skills lab, or if they have other clinical labs, or, in clinical, and also in certain simulations, depending on how your program is set up, okay? This is a good time to practice with your partner, on your family member, on yourself. The more you practice, the more the things will stick. Does that make sense? Now, if you're looking for a resource to help break down the entirety of nursing school, you can go and check out Nursing School in a Box. It covers all of the core classes. There's planners in there. There's review guides in there. There's a bunch of resources in there as well that will help you along on your nursing school journey. If you have any comments or questions, you can put them down below. And if you have any suggestions, you can also put them down below.